The new normal for COVID-19, but for some, this has been their reality for a long time. 6 on Your Side's Jessica Taylor explains.
A local mom I spoke with has 2 daughters living with CF, and she says in order to get her daughter a necessary face mask at the hospital, she had to go through a whole procedure, and she was eventually given one from the locked area of their pharmacy. These medical supplies are just one area in their day-to-day where they're experiencing more issues. Better to prepare than to panic for COVID-19, but hoarding medical supplies like gloves and masks leads to more serious problems for people with serious illnesses like cystic fibrosis. Given that people are stocking up on gloves and face masks and things that your girls really need daily, is this creating any issues in terms of your supply?
Actually haven't been able to buy a mask for Maddie, and the hospital staff is having to use child mask when they come into her isolation room. We can't order our mask online because they're all sold out.
Even hospitals and clinics are running low.
Those resources are really necessary for people coming into clinic who have a chronic disease such as cystic fibrosis.
People living with CF have a fully intact immune system, meaning they're not immune compromised, which is a big factor for coronavirus. But their lungs have a harder time responding to disease.
The issue is if they were to get sick with coronavirus COVID-19, they're at higher risk of having more severe disease. They may be at higher risk of death.
The mild symptoms of flu or colds, like coughing, nasal drip, can quickly get out of hand.
Like a sinus infection for her could lead to a 2-week hospital stay in reverse isolation.
Not to forget the intense stress on our healthcare systems COVID-19 is creating.
It's important to have those doctors ready and ready to have me.
Also, those empty grocery shelves are creating a big mess too. People with cystic fibrosis need a specialized diet, primarily with high sodium and fat.
Has that been harder to stock your pantry, or have you been giving out more food to patients or anything like that?
There has been some increased food insecurity for sure in our CF clinic over recent weeks.
Dr. Brown says to him it feels like the calm before the storm since patients are staying out of the clinic. However, this can be a potentially bad thing for people living with cystic fibrosis if they're not getting their normal checkups and health surveillance that they need. Reporting in Boise, Jessica Taylor, 6 on Your Side.